Suzanne von Blumenthal is joining me from Logosynthesis Institute in Bad Ragaz, Switzerland. Suzanne is a psychiatrist and psychotherapist, and she has been involved in training and further education of specialists in the field of psychiatry and psychotherapy for over 30 years. This includes her role as long-standing chief physician of the Graubünden Psychiatric Services, as a supervisor for prospective specialists, and as a member of the Swiss Society of Psychiatry and Psychotherapy Specialist Commission for further education and training. As a master trainer in logosynthesis, Suzanne has headed the Logosynthesis Institute Switzerland since 2017, and she trains specialists in logosynthesis at many levels. Additionally, she is a founding board member of the nonprofit Logosynthesis International Association, and she currently holds the role of Chair, Evidence and Innovation to lead strategies to build the base of evidence for logosynthesis, including peer-reviewed research initiatives. Thank you so much for joining me, Suzanne.
Thank you for inviting.
Yeah, I'm really looking forward to our conversation. There's so many topics that we could speak about, but today I really wanted to delve into the topic that's an issue for so many people across all age groups and to varying degrees. So I'm interested in learning more about attention deficit hyperactivity disorder, known as ADHD, and how logosynthesis can be used as an integrative model to treat ADHD. So I think it can be an interesting conversation. So to start, can you describe how you were introduced to logosynthesis and what made you curious to train in this model?
I was introduced to logosynthesis from Willem Lammers himself. He invited us psychotherapists of Graubünden to a meeting to make a presentation about logosynthesis for the first time. And I remember that evening in Bad Ragaz where he introduced the logosynthesis model in front of our psychotherapy field, and I was really thrilled about it. I thought, now I found this is a model who is very effective and very quick and with a quick relief, and can give many hints. I really tried it on myself the first time. It's like we were doing with these 3 sentences, and then I thought, oh, it's great. What change was in perceiving in my body. My emotions were instantly different. So I was wondering how this model would work, and I went then to seminars with Willem Lammers to do the practitioner in logosynthesis. And then I thought, oh, I could join Willem to some incentive to go with him with seminars. Then he told me, oh, you could overtake the institute. It was 2015, and then I had to think about how can I do it and when do I do it, and so it was 2017 when I took over the institute.
Can you describe attention deficit hyperactivity disorder? So if we're talking about different types of diagnosis that people come with, does it differ if we're talking about it clinically in the field of psychiatry as compared to everyday language related to school and work issues?
I think it's very similar. We have 3 key symptoms of 3. Yes, the key symptoms include the inattention. So they have difficulty to focusing on tasks. They are something forgetful and somehow disorganized, or they have a tendency to procrastinate. So they are not just on their track. They get easily distracted and are not so focused. The second is the hyperactivity. This is a symptom what is not in every client present. These are excessive movements and inability to remain very seated or quiet in situations where it's expected. And so in schools, you'll see it very often if the children are running around, but not every child who's running around has ADHD, is hyperactive. So I think it's somehow related to the age to get used to sit still in the school, but I think they don't manage it like other children do. So this is a very you see it very often then. And the third one is the impulsivity. You are acting without thinking, interrupting others, and have difficulties to waiting for your turn. So you are in steady and want to share everything. And the ADHD is always their miscellaneous symptoms. They're not all with every client is present. So, but we all call it still the ADHD. So the H is still remaining even if you don't have the hyperactivity. They are sometimes very creative. They sometimes can focus if they are willing or they are interested or motivated. They are very focused and can also have good strategies to think. So even if you have the ADHD, you could have a normal career as in school or in university. So you sometimes you see the ADHD later on as an adult, never knowing that you had it already as a child. So I'm treating adults, so I see also adults who are diagnosed later on as an adult, not as a child. But sometimes they have some severe mental illness like depression, or some have also addiction, and then you discover, oh, there's also ADHD.
So I'm curious then, based on your professional experiences, is the incidence and the severity of ADHD increasing in recent years?
I think the incidence is not much more, but I think we are looking better on it. So 4% of the whole population suffers from ADHD. That's a very high number. But I think we are now detecting more of those cases or those persons who suffer from it, because our diagnosis systems are better and you are looking better. That's the one side, one thing. The other thing I think is the situation of stress or the situation of distraction in our days. It's about the social media. It's about the games, sitting on the screens, not only the TV, but at the moment also in different others online gaming and social media and so on. So it's much more information what is going into the field of children growing up than I used to have when I was a child. So I think there's a difference.
Yeah. So can you offer an overview then how logosynthesis can be integrated into a treatment plan to address ADHD?
Plan is behavioral therapy. I think it's still worth to use this model. I think all different other modalities are, and what discussed widely are the medications and how you use the medications, and the opinions are differing. So you have to, and the others say, no, I want to I have medication. So I see that sometimes it's good to be on medication. Sometimes you don't have to use it because there's no use of it in your daily life. You can have medication or not. I don't think that is you have to have medication. You can also be without. So I think it's very good to look how long you are on medication. But for learning and for somehow also diminishing activity, sometimes you have better focus also in the cognitive behavior, and so you have somehow better learning with medications. But I see also adults who don't need any medication because they have no use. It's not better with medication. So this is very important to look at it. And in logosynthesis, what is there, I use it for over 15 years, and not only for ADHD. What I discovered is that logosynthesis reduces stress symptoms and is dealing to clear or how your brain is dealing with information. So the stress reduction is very good with using logosynthesis. And also you can deal with different injuries to let them go or to change them. So the stress reduction and also the emotional reactions are going down. And then if the emotional reactions are going down, your cognitive or your cognitive brain is working better. So it's about stress relieving.
Yeah, because you're not really stuck in that kind of react, distract mode as much, are you? If you can kind of identify what triggers you to get into that distract mode. So do you kind of focus when working with someone with ADHD on specific situations when they are distracted or impulsive or hyperactive? Or do you work more on general terms?
I used until now only the one-to-one situation with one client in my practice, psychotherapy practice, and then I do it also what is stressing you, what is like the procrastination or not the hyperactivity or the activation about some serious situation at work or about learning or about some relationship issues. So it's just a normal psychotherapy, and it's all about the stress reduction. So what causes stress, and I just go for those issues like in other psychotherapy. And some weeks ago, I started with a colleague, with Marcus Hemmerly, I started a new program. It's a HDHD group program, which where we now treat 4 clients. It's the first course where we have two issues. One is to get educational part where we give the information how could they use logosynthesis as a self-coaching, to how that they get known to logosynthesis, to use it for themselves.
Yeah.
And in the second part, I take over the psychotherapy program, 1.5 hour also for psychotherapy in the group. So I work with one, and the others could watch it, and some could integrate also what they see there, because they have very similar issues. So let's see what is going on.
Yes, we sometimes call that on the bus, don't we?
Yes.
That when somebody presents something that bothers them, it can tend to be a little bit more widespread, doesn't it?
Mm-hmm.
Yeah.
And the client like it very much. So next week, in 2 weeks' time, we will finish the first course, and then we will have we'll see what is the outcome, and we will start with the second course this year already, and we will continue next year to have those courses in that regards. And
I find that interesting because definitely in a group, people start to realize that, issues that we tend to keep inside and don't, we don't like to talk to them, and we know that we have a medical diagnosis around it. So sometimes there might be some shame around it or some discomfort around talking about it. But when they're in a safe group with 4 clients, it sounds as if that's something that you can quite quickly start to see how similar a lot of these situations are. And I say that just from my training with logosynthesis, a lot of it is in groups, and so many of the issues per se are similar issues, aren't they?
they are very similar, and so they see what could happen if I use logosynthesis, and they could watch, and so also see how they could use it for themselves. So what are the triggers? It's not so easy to find the triggers, and what are the reactions? And so they learn also in this psychotherapy group or part. So they see how I apply the logosynthesis, and I think it's much more efficient if you have a group, not only one-to-one, because you have only one client and then the other. So if you have a group, I can take up to 10. Then you are more efficient. There are more people see it at the same time or learn it at the same time.
And there's so
And
many aha moments in that learning because there's things that we thought were part of our personality or things that, some of the labels that we carry with us. And then it's like, that's just frozen energy. I don't have to stay stuck in that reactive pattern or that stress pattern. I can shift it. Yeah.
Yeah. And we have this program only for 6 afternoons planned, and then it stops, and then they go on their own.
Wow.
They are the most of them are also in a psychotherapy of their own. So it is a combination of the psychotherapy or the medication they are taking and this group program.
And again, that speaks to the integrative nature of it, right? Like you're not saying do this instead of doing medication or individual psychotherapy, but it's something that can complement the work quite well.
Mm-hmm.
Yeah. And so this work that you're doing, this group is meeting in person, but I understand you've also written a paper on virtual psychotherapy or virtual group counseling with logosynthesis.
Yes, it's for the first. We wanted to go local because of the focusing or the concentration. We didn't know how is this attention level with the person. So we thought it's easier to have them on local to see how they are attentive and get through the process. And we see it works very well. And if we have to use the second or the next courses to see if it's very easy to get them focused for 1.5 hours for each part, then we could use also the online thing. But then I think we could make a different outline that we have shorter times for working times. But we first wanted to have them on site to have them more connection, because on the screen you don't have so easy to connect and to hold.
Yeah, and if you're prone to distraction, there's a lot of distraction you can find on the screen.
Yeah.
However, I do a fair amount of online work in groups with teaching the Logosynthesis 101 self-coaching course, and I find, yeah, it is so enriching. People get so engaged in the work that that the time flies by, but it's a lot of awareness raising and shifting and energy shifting. So it's yeah, it does work well with the virtual, but I can see the point if you're dealing with people with a diagnosis of ADHD to have that in-person live is pretty powerful.
Yes, and so we have to see how it works, and then if we make the review, and also after the first one, you can't really do the review, but we have to have some more courses done, and maybe we could make them or train other coaches or counselors to do this program. Also in Germany, for example, we are already in connection with some logosynthesis practitioner and counselors, and so we could distribute this program also in other languages. Of course, we could do it also in English, and then I think it should be then online, because the English group is very
We'll bring
distributed
it to
all over the
Canada.
world.
We'll bring it to Halifax here, and
Yeah.
Shanda can teach the program. So
Yeah.
yeah. So I recognize that there's a need for published peer review research because so many people that I speak with, myself included, want the proof that it offers lasting relief. So we've already talked a bit about it, but do you use logosynthesis in therapy and education to relieve the symptoms or to heal the underlying issues? So can you speak in terms of that immediate and sustained or immediate and lasting relief that we talk about in logosynthesis?
Okay, I think you can't really heal ADHD. The ADHD, it's about the different connections. The brain is working differently than the neurotypic version of the normal human beings, so normal people. So it's you can't, but you can develop different or more or other connections which are between the brain cells. So that's about the learning. So you can train the brain to learn. How do you call it? The motivation part of the brain, the motivational processing, and so all this you can influence by reducing stress. So if you reduce the stress, it's not only about the stress reduction, about these techniques like on this model like logosynthesis. There are also different other things you could use, and so. But what we want to show is also that we how logosynthesis is working on the brain, or how logosynthesis works at all. So we are not far with the research or with the evidence we have. That, of course, I see the clients now for over 10 years, and I see the benefit and also the healing part of it, but we have not done the evidence really. Only read one study I did, a pilot study, but a pilot study is nothing. So you see that you can get a better life balance, but it's we have to do more research on it. And I don't know if we could use this program for research or for seeing what is the evidence, because it's only lasts 6 times, and this 6 times about 3 months, and I don't know if the change you see with the symptoms in this short time. So we have to think about the methodology of the research project. So we are still in the very beginning of it.
Yeah, and I think of it as you're speaking. I think about in logosynthesis, we work with, starting with the distressing symptoms, the thoughts, the emotions, the physical sensations, and then we use that to allow the triggering memories, beliefs, and fantasies that arise, that we can identify them and then use the logosynthesis sentences to shift them. And when we shift the memories and the beliefs and the fantasies, then we also relieve the symptoms. But with something like ADHD, oftentimes um, it's much more than one memory or one belief that gets programmed, right? It's all those that conditioning that we experience as a child that triggers our stress response. And so, um, but working layer by layer, we can make meaningful shifts. So I can appreciate when you say working in 6 sessions, you can make some meaningful shifts in how an individual might feel, but it's a matter of a longer process to kind of relieve those stress responses, I think, isn't it?
Yes, I don't know what is the outcome now.
Yeah. Yeah. Well, and so, I mean, I came to Logosynthesis as a busy working mom, and of course, there was nothing wrong with me at the time. And I certainly didn't have ADHD. But, if I listen to you with the symptoms or if I read the symptoms on any website, um, I think that 10 years ago, I could easily put a check mark beside many of those symptoms. And yes, they probably went back to my childhood. Um, and so I, yeah, and a little bit to your point, you're talking that now we're more keen on diagnosing it. But I guess my interest to use logosynthesis was, and it still is, as a healthy lifestyle practice. My professional training is in dietetics, so it's all about developing healthy lifestyle practices rather than a therapeutic approach. But I can say I have definitely experienced a significant shift in many of those symptoms. Like I am not near as distracted. I am not near as impulsive. I can recognize situations when I am impulsive and I can address it. So, and I see this not only in myself, but in others that use logosynthesis as well. So, can you maybe comment on the distinction between, if there is one, between psychotherapeutic versus healthy lifestyle approaches? Like, is it a scale of intensity or frequency of symptoms or ability to function? So, yeah.
I think what's very important is that if you look at the point of the hormones in the body, there are different hormones. Also, the neurotransmitters are like hormones like serotonin or
Yeah.
noradrenaline, and it's all about the balance between these hormones. So the hormones balance the life of every cell in your body. So it's about how the regulation goes, and the regulation is very sensitive on what you're getting in and what you're getting out, and this all is measured by the body automatically. So what the base is the nutrition. It's enough food, enough water, and so on, enough oxygen for the basic processes. Then it's sufficient sleep to digest everything what was going in and to let it go. It's not about only food, it's also about the emotions, the thoughts, the memories, the fantasies, and all that. And also, what's very important for the regulation is the physical activity. So this is base for everyone who's living here on this earth. So even if you have a mental illness or a physical illness, or you are not ill, you are in good shape. But these are the basic things you have to deal with, every one of us. And this is also the basic for those who have this ADHD, because sometimes they don't go to sleep, so they are off the whole night. So that's not good. So first you have to say, okay, go to bed before 12 o'clock, and so on. So this is also very important. Also, when I do psychotherapy, before I start the really psychotherapy, I do those psychosocial normal information, what is good for you and how do you regulate your body and your mind or psyche to get well over the day or yes, or the night. And then there are stressful things going outside with relationship in the family, with working place or in the school. And then you address those stressful moments with logosynthesis. For instance, we use it, or I use it now for reducing those stress in those situations that you get along much better without stress, without reaction, with less emotions. Emotions are only signals when you have to let them go. But you can only let them go if you have resolved the trigger, the bound energy. So that's why the logosynthesis is very useful for stress reduction technique. And this is very important for ADHD, but I think for every kind of mental illness, it's the same. It's about stress reduction and a good life balance with nutrition, sufficient sleep, and physical activity.
Yeah, and I think of it, I started sharing like the energy of healthy living, right? So if you think of the energy of the food we eat, the energy of restoring our energy, sleeping, the need to get our energy moving through physical activity. So it is all about the energy of healthy living. And logosynthesis is an energy model. And I think what really attracted me from my background is that there was in all of this healthy living talk, there was something that was missing for me. And to me, it's that energy that's bound in those memories, those beliefs, and those fantasies. So all the experiences that we have in everyday life. And so sometimes we think, well, something happened, it wasn't that big of a deal. And yet it's kind of frozen our energy into a belief that, maybe I'm not good enough, or maybe I have to work really hard, maybe I have to work faster, I have to be perfect, like all of those drivers, and that energy gets kind of frozen. It's not accessible to us. It's not available for healthy living. And we think everyday terms, but then also when someone has a severe accident or experience the loss of a loved one, especially at a young age, like those memories um, really block our energy, and it inhibits the energy that we need for healthy living. And that's exactly what logosynthesis works to identify and to resolve. So it's a nice aspect in there. And so when people come for psychotherapy and they have a stressful situation, it does integrate nicely to be able to identify and then resolve the underlying stressor, right? Like the
Yes.
underlying trigger.
And the difference about psychotherapy and counseling or coaching is only the where you address these triggers. If the triggers are in the life of nowadays, on here and now, or only some years ago, but not in the childhood. I think those memories of the childhood are sometimes unconscious and also hidden, not known, not you couldn't speak about it, and then you need more techniques to get them on the surface to treat them, and that's a difference between the psychotherapy and only the psychosocial counseling. Also, this is another layer. It's much more conscious. On the conscious layer, you can deal very easily with the technique of logosynthesis or other techniques. Therapy deals also with subconscious or unconscious experiences, and so to get them into activate them, it's another technique you use in psychotherapy. That's the difference.
Yeah, and I think it really speaks to the the need for the strength of a working alliance, that it's a very trusting working alliance, that there's an understanding of what happens because um, childhood experiences can be hidden, but they can also be extremely intense. So sometimes we look at something that happened as a child through our adult perspective and we think, oh, that wasn't that big of a deal. But then when it gets activated, it can feel extremely intense for an individual because that energy was frozen as a young child or an infant. Um, and it takes them right back to that same physical sensation as at the when it was kind of frozen there. So yeah, so there definitely is dealing with childhood experiences. They can be much more intense than what we might
And they
realize.
are, yes, and if they are activated, then you have to know how to deal with it because you are on an existential level, and there you are the fight, flight, and freeze conditions, and then you have to know how to deal with it. And this is a special training we have as psychotherapists
Yeah,
how to deal with it. So it's very important that you know how to go with a client who is activated in this way, like freezing, as right example.
yeah, yeah. Thank you for that, Suzanne. So, yeah, I'm just wondering if you maybe have to wrap up, is there a key message that you would like to share those who are struggling with ADHD and also those who are in the healthcare field or the medical community that are looking for effective treatment modalities to support their patients?
I think it's very important to be in line with a good working alliance. So you just mentioned before, it's about information that you know what is HDHD, what are the typical symptoms, and how they struggle in the daily life, and guiding them through this struggling and let them know how they can use also logosynthesis for themselves and to get them into some coaching or counseling or psychotherapy to let the stressful memories or fantasies uh, let them go. And so there's also need lots of patience on both sides. And but I worked also with a young man who was in psychotherapy with other psychotherapists, and he told me, I am going to look if it works, and he still is on track, and because it's different, the log synthesis way is different. You're not so in the thinking mode as well, but you're very much focused on one trigger. So it's very short, and you don't have to have so much concentration on what you're saying. And from the first minute of the therapy meeting or session to the last one, so it's very much easier, just easier to go. So they like very much therapy, and I think it's very important to get them the also the hope that they can change something. It's not you can change something about your going into your life and how to you manage your life. You can also make a career with HDHD. It doesn't minute or disable you as well. So I think it's very important to get your guiding or get someone who is guiding you through.
Yeah. Yeah, thank you for that because I think you make a good point that for people it is hopeful and that there is a way forward. And yes, it's not a one and done. There's a maybe a long process, but it is something that we can empower ourselves to both work on our own and with someone else and in a group, and we can start to make shifts on it so that it doesn't have to cause us to suffer as significantly. And I know for me, it's extremely liberating to let go some of those tendencies of, react and driven on impulse and into tentativeness and that. So thank you so much for this conversation. I really appreciate your time and your expertise, and I look forward to sharing it.
Thank you for the invitation. I'm looking forward to meeting you again.